Hello, everyone, and welcome back to Healthy Talks. I'm Emily, and I'm here with Dr. Steven. We've all been there, that uncomfortable, tight feeling after a big meal. But when is bloating just part of the meal, and when is it a warning light from your body? Dr. Steven, how do we know when it's time to stop Googling and start seeing a doctor?
Well, first off, it's great to be here. And to answer that, we really have to define what a normal baseline even looks like,
Yeah.
because people have these highly unrealistic expectations.
Right, like we all just assume a completely flat stomach is the default state 24/7.
Exactly.
Yeah.
Which is totally a myth. I mean, your digestive tract is this active dynamic processing plant. The average person actually passes gas 15 to 21 times a day.
Wait, up to 21 times?
Yeah, up to 21. It's completely biological. All that air and, the chemical byproducts from digestion, they simply have to come back out.
Okay, so if you're hitting that average, your system is probably doing exactly what it's supposed to do.
Precisely.
Yeah, you're fine. But here's where it gets really interesting, because I was looking at the research, and the root cause of exceeding that baseline isn't always about the food itself. Sometimes it's entirely mechanical.
Oh, absolutely.
Like you can literally pump air into your own stomach without even realizing it. We're treating our stomachs like a bicycle tire and just operating the hand pump all day long.
That is a brilliant analogy. Medically, we call that aerophagia. You're swallowing a tiny amount of air naturally when you eat, but common habits can drastically multiply it.
Like talking while eating. I know I'm definitely guilty of that one.
We all are. Talking animatedly, eating too quickly, you're physically forcing pockets of extra air right down your esophagus.
And drinking carbonated beverages, obviously. You're just choosing to swallow gas bubbles.
Right. But it's the hidden habits that catch you. Chewing gum at your desk, sucking on hard candies, or drinking your iced coffee through a straw every morning.
The straw! I never even thought about that.
Yeah, you're just continuously swallowing little pockets of air. Even poorly fitting dentures can cause it.
That's wild. Okay, so beyond the mechanical tire pump issue, we have to look at the food itself. And this is where I think people get incredibly frustrated.
Because the culprits are usually healthy foods.
Yes. You eat a huge bowl of like roasted cauliflower and lentils, thinking you're doing your body this massive favor, and 2 hours later you feel like a literal zeppelin.
It's so common. And it comes down to a biological mechanism called bacterial fermentation.
Okay, break that down for us.
Sure. So humans actually lack the specific digestive enzymes needed to break down certain complex carbs and sugars, often called FODMAs. You find them in beans, broccoli, cabbage, onions.
So they just travel right through the stomach intact.
Exactly. They pass through the stomach and the small intestine completely undigested. And when they finally hit your large intestine, the billions of bacteria living down there just treat those sugars like an all-you-can-eat buffet.
Oh, wow. So the bacteria are feasting on the food we couldn't digest.
You got it. And just like any organism eating, they produce waste. In this case, gas, hydrogen, methane, carbon dioxide.
So the bloating isn't the physical volume of the broccoli in your stomach.
No, not at all. It's the massive volume of gas produced by your gut microbiome reacting to the broccoli.
That makes perfect sense. It's basically a localized fermentation plant.
It really is.
But what about artificial sweeteners? Because I notice things like mannitol, sorbitol, xylitol, they trigger huge issues too, but the mechanism is different, right?
Yeah, sugar alcohols are a double-edged sword. They operate heavily on osmosis.
Osmosis, like pulling water in.
Exactly. They're hard for the body to absorb, so they just linger in the digestive tract. And as they sit there, they actively draw water from your surrounding tissues directly into your intestines.
Wait, so you're literally flooding your own gut with water just by chewing sugar-free gum?
Basically, yeah. You pull fluid into the bowel, which creates this heady, sloshing sensation. It can cause rapid transit and diarrhea. And to make it worse, whatever isn't washed out gets fermented by those bacteria we just talked about.
So you're swallowing air from chewing the gum, pulling water into your intestines, and feeding gas-producing bacteria.
It is the absolute perfect storm for severe bloating.
Okay, what's fascinating here is that you don't really need a doctor to fix these mechanical and dietary triggers. You just need to pay attention.
Exactly. This is where a simple low-tech tool comes in, the one-week food diary map.
A food diary map. I love that.
Yeah, you just track what you eat, your habits, like the gum or the straws, and you literally map out the triggers. You find the pattern, cut the trigger, and the bloating resolves.
But okay, let's unpack this. What if you do all of that? You ditch the straws, you cut the sugar-free gum, you limit the Brussels sprouts, and you are still in agony.
That's when we have to look at the speed of the system. We have to look at motility.
So let's use an analogy here. I like to think of the digestive system like a massive highway tunnel. If you're perfectly healthy, the traffic flows.
Right.
So normal bloating from a big holiday meal is just like a holiday weekend slowdown. There's too much cargo, traffic slows to a crawl, but eventually everyone makes it through the tunnel.
That's a great way to visualize it. But what happens when the traffic completely stops?
Right, like a major accident. So if we talk about gastroparesis, would that be like a breakdown right at the on-ramp?
Yes, exactly. Gastroparesis literally means stomach paralysis. The nerves or muscles controlling the stomach, specifically the vagus nerve, they just aren't firing.
So the stomach empties way too slowly.
Right. The food just sits there at the
Yeah.
on-ramp. And because it's delayed, it ferments way too early in the process. You get intense upper abdominal bloating, nausea, and you feel completely full after just a few bites.
That sounds miserable. And then on the flip side, constipation would be like a massive backup at the final exit of the tunnel.
Precisely. The large intestine's main job is absorbing water from waste. If the traffic is stalled at the exit, that physical waste sits there too long.
And it dries out.
Right. The water's extracted, it turns hard, and meanwhile the bacteria behind it are still fermenting and producing gas.
So the gas is trapped behind this physical roadblock of hardened waste.
Exactly. The pressure builds backward. You might not even realize you're constipated until the severe bloating forces you to pay attention.
And the treatments for those two traffic jams are total opposites, aren't they?
Oh, absolutely. If it's just an exit backup constipation, you hydrate, add fiber, use an over-the-counter remedy. You're lubricating the exit.
But if it's gastroparesis at the on-ramp,
Adding bulky fiber to a paralyzed stomach will make you infinitely worse. Gastroparesis requires real medical intervention, prescription meds, liquid diets, sometimes even surgery.
okay, so we've got the highway tunnel speed covered. But what if the traffic is moving fine, the food isn't the problem, but the tunnel itself is overly sensitive? Let's talk about irritable bowel syndrome, or IBS.
IBS is incredibly common, and it's fascinating because it's not a structural blockage. It's visceral hypersensitivity.
I really want to push back on something here, though. In a lot of older literature, you see IBS called a spastic colon or a nervous colon.
Oh, I hate those terms.
Right. Doesn't calling it a nervous colon make patients feel like the severe cramping is just all in their head, like they're just anxious?
If we connect this to the bigger picture, that has been a massive historical frustration for IBS patients. Doctors couldn't see a visible ulcer, so they implied it was psychological.
Which is so dismissive.
Completely. But the clinical reality is that IBS is a very real physical hypersensitivity driven by the enteric nervous system, our gut's second brain.
So it's a software glitch in the tunnel's alarm system.
Yes, in a healthy person, normal gas stretches the intestinal wall maybe a millimeter. The brain ignores it. But with IBS, those nerve receptors are hypersensitive. That exact same millimeter stretch sends a screaming alarm signal to the brain.
The gas volume is normal, but the pain response is dialed up to a 10.
Exactly, and that causes extreme cramping and alternating diarrhea and constipation. It requires targeted lifestyle management, specific probiotics, and sometimes nerve-calming medications.
That distinction is so validating, but contrast that invisible software glitch with something very visible and structural, like diverticulitis.
Now that is a hardware failure. It starts with diverticulosis, which means weak spots in your colon wall. Think of an old bicycle inner tube.
Right, you pump it up and a little bubble bulges out of the weak spot.
Exactly. Those pouches are called diverticula. Having them is common, but diverticulitis happens when those pouches trap passing debris or bacteria.
And they get infected.
They fester and become actively inflamed.
So you're not dealing with gas sensitivity anymore. You have a localized infection in the wall of your organ.
And the symptoms aggressively shift. You get acute tenderness, nausea, and the major red flag, a high fever.
Oh, wow. So a fever means you need an entirely different response.
Absolutely. Antibiotics, liquid diets to rest the bowel, and if a pouch ruptures, it's a surgical emergency.
Okay, so we've looked at the speed, the sensitivities, the structural weak spots, but what happens when the whole system just fails to do its main job? What about the serious systemic red flags?
This is where we look at exocrine pancreatic insufficiency, or EPI, and inflammatory bowel disease, IBD.
Let's start with EPI. To use our tunnel analogy again, EPI is basically like having all the toll booth workers just mysteriously vanish, right?
That is a fantastic way to look at it. The pancreas fails to produce the digestive enzymes the workers necessary to process the cargo.
So what do those workers normally do?
They act as specialized chemical scissors.
Mm.
Amylase for carbs, protease for proteins, lipase for fats. They cut the food down so it can be absorbed.
So what does this all mean for someone with EPI? If there are no workers to process the cargo, what happens?
The food just sits there in the tunnel. It ferments heavily, creates a massive gas backup that won't budge. And because you aren't absorbing nutrients, you're literally starving on a cellular level, even if you eat huge meals.
And this leads us to some hidden clues, right? Because if the body isn't processing fat, that unprocessed cargo has to go somewhere.
And it ends up in the toilet. It's called steatorrhea.
We have to be honest about the bathroom habits here because it's vital.
You cannot be squeamish about it. If you have pale, greasy, foul-smelling stools, and especially stools that float and stick to the bowl, that is a massive flashing red light.
Because fat floats.
Exactly. Your body is saying, we have no lipase to process this fat. It leads to severe weight loss. The treatment is taking the missing chemical scissors in pill form with every meal.
Oh, wow. Okay, and then the other systemic issue is IBD, inflammatory bowel disease, which includes Crohn's and ulcerative colitis.
Right. If EPI is missing workers, IBD is massive structural damage. Potholes and road damage everywhere.
It's an autoimmune issue, right? Friendly fire.
Yes, your immune system mistakenly attacks the lining of your digestive tract. It creates deep ulcers, swelling, and chronic bleeding.
It's tearing up the actual walls of the tunnel.
And the symptoms reflect a body at war. Visible blood and mucus in the stool, chronic fevers, severe fatigue, urgent diarrhea, and again, significant weight loss.
Those are massive hidden clues. Weight loss and major changes in bathroom habits mean it's not just a big lunch.
Exactly. It requires aggressive medical intervention, immunosuppressants, biologics, sometimes surgery to remove the destroyed road.
Okay, so having laid out this entire spectrum, we need to give you guys listening a clear boundary. When do you cross the line from I can manage this at home to I need a doctor right now?
First, look at duration. If you've tried over-the-counter stuff, you did the food diary map, you're hydrated, and it still persists, call a doctor.
I always like the 3-day rule. If the traffic jam lasts more than 3 days or happens every single time you eat, the tunnel needs a professional inspection.
This raises an important question about your personal baseline, because humans adapt to feeling awful.
Yeah, we really do.
But you cannot normalize chronic pain. If you have unexplained weight loss, total loss of appetite, persistent heartburn, or any blood in your stool, make the appointment.
And if you have sudden, sharp abdominal pain, a high fever, or chest pain, that's not an appointment, that's an ER visit immediately.
Absolutely. Could be a ruptured diverticulum or a severe obstruction. Go to the ER. And when you do see a doctor, be brutally honest. Bring your symptom tracker. Tell them if your stool floats. Those gross details are the map they need to diagnose you.
Right. And while you're waiting for that appointment, there's one really simple strategy you can use right now. It's an anchor tip I love called the slow lane habit.
Oh, the chewing technique.
Yes.
Yeah.
Just consciously chewing every single bite 20 times before you swallow. Digestion actually starts in the mouth with an enzyme in your saliva.
Salivary amylase.
Exactly. By chewing 20 times, you do half the mechanical work for your stomach, you help those toll booth workers out, and you drastically reduce the air you swallow.
It's a fantastic foundational habit.
And pair that with a symptom tracker. Note if the bloating comes with actual pain, because pressure from gas is one thing, but sharp pain is a signal to pull the car over immediately.
Pain is never just normal digestion.
Right. And that leads me to a final thought I want you to mull over today. We get so used to a low-level baseline of discomfort that we completely stop noticing the toll it takes on us. We have this boiling frog syndrome.
We really do. We just accept feeling sluggish.
Right. You assume it's normal to have a low-grade stomach ache every evening, but what if that afternoon energy slump, that brain fog, or that terrible mood isn't just work stress? What if it's a misdiagnosed food intolerance or a subtle gut issue quietly draining your cellular energy? If that inner balloon is constantly inflated, it puts pressure on your sleep, your mood, everything. So listen to your inner highway and don't ignore the warning signs. Thanks, Dr. Steven. See you again in the next Healthy Talks.